Good evening and welcome to the Mega News at 6 p.m. coming live to you from our studios here at Nungwa Greater Estate. Don't forget, we are streaming live on our social media platforms on YouTube and Facebook at MBN 360. I am Farah Ayi, coming up in the major headlines.
Mahama targets regional hospitals by 2028 as first 3 takeoff. In business, GFIM liquidity boom pushes trades past 1.5 billion Ghana cedis in a single day. And on the international front, former Nigerian minister sentenced to 75 years in rare corruption verdict.
In our first story, President and NDC flag bearer John Dramani Mahama has announced an ambitious health infrastructure plan aimed at expanding regional healthcare delivery with 6 major hospitals targeted for completion by 2028.
Under the proposal, the first phase will see 3 regional hospitals taking off for construction and rehabilitation works, forming the foundation of a broader nationwide upgrade to secondary healthcare facilities. The plan is expected to focus on improving specialist services, reducing pressure on tertiary hospitals in Accra and Kumasi, and expanding access to emergency and diagnostic care across underserved regions. Mahama says the initiative is part of a long-term strategy to strengthen Ghana's health system resilience, with emphasis on modern equipment, increased bed capacity, and improved staffing structures. Health sector stakeholders are expected to review implementation timelines, funding models, and regional seating priorities as the rollout begins.
We have commenced the procurement processes for the construction of 3 new regional hospitals in 3 of the newly created regions to improve healthcare outcomes for the people who live there. And by the end of 2028, we'll provide 3 more regional hospitals for the remaining 3 new regions. We recently procured 3 new catheterization laboratories, popularly called cath labs, for Kolebu Teaching Hospital, for Konfanoche Teaching Hospital, and for Tamale Teaching Hospital. These labs will improve the diagnosis and treatment of cardiovascular conditions in the south, center, and northern parts of our country. At the Tamale Teaching Hospital, we're also building a new cardiothoracic center to save heart disease patients from traveling all the way to Kumasi and Accra to seek treatment. The Volta Regional Hospital and the Cape Coast Hospital will also have new cardio centers built to cater for patients in the eastern and western parts of our country.
President and NDC flag bearer John Dramani Mahama is framing his Accra Reset agenda as a bold continental call for health sovereignty, arguing that Africa must reduce dependency on external systems to strengthen its healthcare independence.
Speaking on the emerging policy direction, Mahama says the Accra Reset's vision is designed to reorient African health systems towards self-reliance, stronger domestic manufacturing of essential medicines, and response. The concept places emphasis on building resilient health infrastructure, investing in local pharmaceutical production, and enhancing training for healthcare professionals to reduce reliance on foreign medical supply chains. He argues that the COVID-19